Welcome back. We've all been hearing about the bird flu that's been detected around the world in chickens, wildlife, ocean life, even humans in some cases. Last week, we learned that birds in New London County tested positive for bird flu. So does that mean we should be worried about it infecting people here in Connecticut? Dr. Manisha Juthani is commissioner of the Connecticut Department of Public Health. She joins me now to talk about bird flu and the increase in some cases of other viruses as well. Commissioner, welcome.
Thanks for having me, Eric.
Here's the behind the curtain look at how things work here on CT 25. If I see something and I say, whoa, I tell Tracy to book Commissioner Juthani to tell me if I should be worried about it. So I saw a New London Day article saying that there was a flock of birds that tested positive in New London County. I thought that was unusual. Did you, and are you worried about it?
So we've been monitoring H5N1, or what is also called avian flu or bird flu, for actually many decades, but more particularly over the last couple of years, because we've seen more and more episodes of wild birds and then more domesticated birds or chickens who've had cases of this bird flu. And many people have heard that over the last several months, there were cows that were also infected by this same virus. And that went through a number of different herds in various different states. To be clear, we have not had any cows in Connecticut that have been infected. And as you mentioned, when you have backyard birds, they may interact with wild birds. And so it is suspected that wild birds infected this group of backyard birds. And the risk to humans is low. But if you see an infected or sick appearing bird, one that is having respiratory secretions, doesn't look well, as a human being, you want to stay away from that, because the reality is the risk to humans is low. But if you have direct contact with a sick animal, that is the situation in which humans have gotten H5N1, which is the virus that has been called bird flu as well. So what we're really trying to prevent is those types of incidents from happening. We have no evidence that there is person-to-person transmission, but we don't want to create opportunities for the virus to learn how to do that. So I think in general, what I want people to know is, yes, there have been more birds in Connecticut that have been identified. If you see a sick animal, bird, etc., do not approach it. Again, if it's a kind of situation where you have to, you can call animal control. And there are a series of information out there through our Department of Environmental Energy Protection, or DEEP, where you can find out a wild bird, particularly how to deal with that. And if it's more backyard flock, our Department of Agriculture helps with that as well.
All right. So stay vigilant, I think, is your message, but no need for alarm. Is that fair?
Absolutely no need for alarm, but we are staying vigilant all the time. The last thing that we want to do is see a case in a human in Connecticut. We are ready to help with that situation should that happen. We are monitoring, but again, right now, we do not believe that the risk is significant.
All right, let's talk about some other things that maybe have a more significant risk to people, and respiratory viruses are one of them. And I know you have a chart, and we can show it to our viewers, that kind of explains all this. So what are you tracking for respiratory viruses? And you can see, we're showing that chart from the DPH website, and you can see some things that are definitely in the upward trend, Commissioner.
Absolutely. So if you are sick right now, stats would suggest that you have the flu. That is the thing that is taking off right now and is continuing on an upward trajectory. As you can see from our data, we monitor the respiratory diseases that are reportable to us. Not all of them are reportable. Not all of them are easily tested. You may have a COVID test, an RSV test, a flu test. Those are the 3 vaccine preventable diseases, which is also the reason why they're important for us to track. They're also probably the ones with the highest burden of disease. So right now, again, it's all the same principles that people know. If you're sick, stay home, wash your hands, cover your mouth. If you're sick and coughing, try to stay away from others. But again, right now, what we're seeing is that COVID and RSV are on the lower side, but flu is still just a straight line up in terms of cases continuing to go up. It is not too late to get vaccinated. Getting out there and getting your flu shot can still certainly help you in these weeks ahead, and certainly for COVID and RSV as well. COVID, as you can see, has been persistent. But I think just to let people know, there's a lot of different disease that's out there right now.
And for people who maybe are standing too far from their TV, it was the blue line on the upward trajectory that showed those influenza cases, which is why you're watching that. I know earlier, maybe around New Year's time, Christmas time, we had a lot of reports of norovirus going around. Is that something you're watching or hearing about?
Absolutely. We've been hearing a lot of norovirus as well. And so again, norovirus is a gastrointestinal virus, a GI bug, causes diarrhea. And a lot of kids were having that, adults getting it from their kids and moving on and on through the community. This is a very highly transmissible virus. It's a very highly transmissible virus. It means you don't need a lot of it to get infected. If you're changing a diaper, if you're helping a young kid, make sure you wash your hands after you help them in the bathroom and wash your hands well, especially if they've been having diarrhea, because it can easily move through a family very quickly.
I want to ask you about, on our first segment, we were talking about with the presidential historian about everything that happened in Washington over the past week. One of the things that some people have expressed concern about is that some of Donald Trump's policies in the health realm and his proposed commissioner, Robert F. Kennedy Jr., having some very different views than what Connecticut has in place. What will you be watching for with the Trump administration on the health front?
So we are watching each of the executive orders and various initiatives that are coming out of the administration on a daily basis and adjusting as we go. One thing that I want Connecticut residents to know is that we as a state health department and our 59 local health departments and districts, they work with us. Our communication with them, they're the people on the ground with you, is open and alive, and we are communicating with them all the time. The work that we do here in the state has not stopped, and we will continue doing what we need to do to try to protect health and safety for the residents of Connecticut. We do rely on our federal partners for a lot of subject matter expertise and information, and they provide us funding. They provide us other expertise that we may not have in-house. That's what we're going to be looking for. Are we going to be limited in some of those ways? But regardless, we do have experts in-house. Much of our authority in terms of public health is within the state. So we are going to still be hard at work for you. That's what we're going to be focusing on and continuing to try to figure out how we will navigate the federal landscape as it continues to evolve.
All right. Well, we appreciate your candor on that topic and on all the others as well. Commissioner Manisha Juthani, thank you so much for being with us here on CT 25.
Thanks for having me again, Eric.